Hello, Cindy, and hello to all of our listeners out there. Welcome to another episode of Secrets in Medical Device Sales, brought to you by the Girls of Grit. We are so happy to have everyone join us tonight, and we have a special guest joining us, don't we, Cindy?
Yes, we do. A very special guest. Hello, everybody. Our special guest, Jim Mercadante, has been in both of Lisa and my medical device career, our lives that we're very privileged to actually work underneath Jim Mercadante. And we are just absolutely thrilled because we feel that there's nobody better to really talk about the topic that we're really going to discuss today. And we thank you so much for coming to be here with us today.
Oh, it is an absolute honor and privilege to be with you two fine ladies. And might I say, you guys are the best of the best. So I am just honored to be on your podcast. Look forward to it.
Oh,
Thank you.
Jim. He's so kind. Jim has been in the AI space now for how long, Jim? And you are, I think now global, you're going to correct me, global VP of customer communications, sales, marketing. I don't know all of it, but
Well,
AI.
let me simplify it for you, Lisa. It's Senior Vice President of
There we go.
growth and revenue. Okay, very simple.
Love it. Perfect. So, Jim, tell us all about not only what got you to AI, but why AI. And then we're going to dive into a little bit of it because I know a lot of our listeners out there are very curious about it. You know, to some degree, it's a little scary for a lot of us, including myself.
Sure.
And so we want to learn more. But tell us first kind of what brought you to AI? I mean, why AI over something else?
Yeah, it's an interesting and important question because most people that are in medical device don't think, hey, I'm going to leave the device world and go software. That's really what it is at the end of the day. But if you look at my background in history, I came out a long time ago out of college with a computer science degree, of which I could not use because the computer world had completely gone into the tank. And somebody, as a recruiter, said, you need to get into healthcare. So I completely reversed course and went into healthcare a year out of college. And my first job was with Abbott Diagnostics. And that was one of the best advice I ever received in my entire life. That really directed me towards healthcare as 1/7 of the economy. You fast forward, I always had a passion for computers, always had a passion for software. And as I went through my career, I was a personal investor in some robotic companies. I have been following and tracking AI, not just within healthcare, but if you look at companies like NVIDIA or you look at some of these other companies, they're all heavily invested in artificial intelligence outside of healthcare. And now as you look towards healthcare, actually robotics came out into healthcare first. And then AI followed, which is a little surprising given that, a lot of AI can run robotics. In my opinion, AI should have came out first, but that's a whole nother debate. Artificial intelligence healthcare, one of the things that I'm so passionate about is I'm on the forefront of technology. I am watching healthcare change right in front of my face. And in the next 3 to 5 years, you're going to see AI, not just the company I'm working for, multiple companies out there really revolutionize the healthcare, not only in the United States, but around the world. If it's not all about detection, it's really about trying to get to that deeper AI. I mean, you need detection, but when you can start measuring volume and do 3D visualization and really map out for the physicians and for the care teams out there, the disease states, let's take aneurysm as an example. If I can say, hey, this patient has an aneurysm, here's where it's exactly located. Here's the 3D volume of that aneurysm. And oh, by the way, track it over time. That makes very big changes within healthcare, and that impacts the patient in a big way. So my personal choice has always been a passion for robotics and AI. And I am fortunate enough that I got a call probably 20 months ago. Unfortunate for my previous company, but very good for me. And what I really want to do and how I want to end my career is on the forefront of technology. So I look at AI as a global impact to healthcare. We're not just impacting one patient at a time. We're impacting millions of patients around the world at a time. And to me, that's probably the most exciting. When you can sit back and think, can I help somebody save them from staying in the hospital? So length of stay is an extremely important metric that everybody follows. But if I can detect that stroke and get that door to needle time under a certain limit, and that patient, that's the difference between a patient going home in a month or a day. That's the difference between the patient walking out of the hospital and going through rehabilitation for the next 2 years. That's the kind of difference AI makes in our healthcare system. And it's just remarkable. So it's not like it's just come out last year, but it's accelerating. It's literally accelerating year after year after year. And what you thought you couldn't do 3 years ago, you now can do. So I'm excited, not only what we can do today, I don't even look what we can do 3 to 5 years. I know what's coming next year, 3 to 5 years from now. Oh my goodness. And people fear that, oh, is this going to take over jobs? Absolutely not. AI is nothing more than a tool that helps any physician, I don't care what type of physician, be able to identify and treat patients quicker and faster. That's it. Better outcomes at the end of the day, better device usage at the end of the day. That's what everybody really wants. And that's what healthcare is, that's what AI is delivering.
Well, I think that is one of the most important things. And if you could just help us dive a little bit deeper into that. I mean, you mentioned like length of stay, and you mentioned that this will accelerate and go faster. So how does that actually, or maybe I should say, help us kind of understand the applications and how this works in the example that you mentioned? How does it make it faster for the doctor and the patient?
So let's think about healthcare in general. So a patient comes in, let's call it stroke, right? Now, radiology, these radiologists that we have in our country are absolutely amazing. If you think about what a radiologist does all day, they really are 300 patients and have to know every disease state. Now, yes, there's a subset of radiologists called neuroradiologists, and they go deeper into neuro, but the general rad, they have to know everything at all times. That's almost a setup for failure, okay? So what AI does is it sits on the scanners, Philips, Siemens, I'm using neuro ones, you could be GE, whatever. AI sits on these scanners and it's able to identify instantaneously a bleed, instantaneously. So that gets shot over to radiology and the interventionalists at the same time. Radiology is confirming it, but the stroke team is deployed instantaneously because there's the old saying, time is brain and minutes matter. And we have been able to see, I don't care what company it is, we've been able to see a reduction of 80% door-to-needle time. I mean, you're taking an hour out of stroke. You're talking about somebody walking out of the hospital versus staying in the hospital for a month. And that's just basic AI. We haven't talked about deep AI yet. That's how much of an impact it's been. Administrators, it's probably one of the biggest topics from a C-suite perspective that there is today. I was at the Becker's conference, which is a healthcare conference for administrators 6-8 months ago. And they did a survey amongst 1,100 participants and asked, what's the number one thing you want to learn about? 950 of them said the number one was artificial intelligence. That says it all right there. So you have physicians wanting to know more, how can I increase procedures? How can I bring costs down? Artificial intelligence is going to be the one to deliver it. So if I can put on every scanner a software that will detect an aneurysm, all right, 40% of aneurysms are missed. There was a study 2 years ago, and I'm happy to provide that study. 40% of small aneurysms are missed. Imagine being able to detect the majority of those aneurysms and be able, they're not necessarily going to rupture, but to be able to monitor them over time, right? And imagine a software that actually takes the aneurysms and compares them year after year in a 3D fashion and can tell the physicians, hey, wait a second, this one has changed. You might want to take a look at it, right? Right now, this is just a visual. They're just eyeballing it. They're measuring it manually in 2D fashion and measuring it. Imagine you got a 3D output that does it automatically and can find it for you and can tell you when to change. Now, again, the physician makes a decision every single time. It is a guide. It is a tool for the physician. So when people say, well, this is going to replace jobs, absolutely not. It's going to help the physicians, staff become more efficient. And this is regards to any AI. It doesn't matter, my company or another company.
So I'm thinking about all of this, and so much of this is over my head, right? I mean, it is like terms that just to the general population, we're like, wait, do we have to learn how to write code? I mean, what does this look like?
Thank God. I don't know how to write code in
Back
a
in
language
college.
that's in a museum,
If you were to quote unquote dumb it down right now for all of our listeners, what can you're saying it's sitting on the software. What do you mean by that, Jim? What do you mean? Is it
I'm saying it's
spying
sitting
on
on a
us?
scanner.
Is it looking at us?
Patient comes
how
in,
does that work? Yeah.
gets imaging done. Okay. Imagine your patient, MRI, CT, CTA, perfusion. The software is on the scan. So it's programmed. Our software sits on that actual scanner. And when the scan is done, our software analyzes that scan in seconds and shoots it off. When it's a positive, shoots it off immediately to the radiology team and immediately to the interventional team. And then they decide on what to do. Now, that's just the basic part of AI. And that's just triage and detection. What I'm saying is, and that's pretty, I would say 70% of the hospitals in the United States have some form of AI for either stroke or something else. You'll see that, I think, accelerate over the next 3 years. If you look at when it really pivoted, the stroke guidelines changed back in 2018. There was a lot of trials, and I'm not going to get technical. There was a lot of trials that came out, but AI was part of that. And that's what made everything take off. And stroke was really the first impact for artificial intelligence in healthcare. But now you're seeing it in PE, aortic, lung. I can almost name every disease state that's out there, and not my company, but there's hundreds of companies developing algorithms now all around the world to try to help with every disease state. Matter of fact, there's technology out there now that you don't even need contrast. We came out with technology last year that we don't even need contrast to detect an LVO or stroke anymore. So where that impact, most hospitals in the US use contrast. Outside of the US, we're a global company. 75% of the world population does not have access to contrast, right? So they have a lower capability of detecting across the board. So we're not only thinking about the United States, but looking at healthcare. This is what I said earlier, AI can impact healthcare globally. And that's the real exciting part to that all.
That's amazing. And you just mentioned some applications. I mean, I'm assuming coronary heart disease. I feel like that's 90% of everybody that goes through the ED is, well, at least everybody thinks about that. Chest pain, shortness of breath, tingly arm. Where do they go? The ED. So I'm assuming it's probably coming to coronary as well. And maybe from there going other.
Listen, I think you can imagine that every disease state, every artery, every vein, every bone, tumor, spine, and I'm talking some neuro applications. You start going heart, absolutely. Coronary is a dead ringer, maybe not by us, but by another company. For sure, there's multiple companies working on it already. Again, detection is first. That's the basic FDA type of approval, is a detection. Then you want, the real thing about AI is you have the detection, and then to go deep AI, you want that volume measurement and the 3D visual, those type of things. That's then taking it to say, it's one thing to raise a flag and say, hey, this might be something over here. Take a look at it, Mr. Radiologist. But it's another thing to say, you may have something, here's where it's located, here's the measurement of it, and here's the 3D representation of it. That's a whole different world when it comes to AI. And that's what's about to happen. There's a few applications and a few companies that can do that in certain disease states. We're the only ones that can do that in the brain. And imagine taking that kind of technology and going right through the rest of the body with it. That's going to accelerate like you wouldn't believe. So I don't even talk 3 years from now. I only talk 6 months from now, because there's so much coming out in the next 6 months. I would overwhelm somebody saying, here's what it looks like in 3 years. But I can imagine a world where in 3 years from now, there's no reason why every disease can't be picked up early and looked at early and treated properly. It doesn't matter the disease state. 3 years from now, healthcare is going to be revolutionized in the United States and around the world.
That is just incredible. And, you mentioned about all these companies and looking at all the different disease states and different areas where they are looking to grow. And it's absolutely fascinating when you can diagnose, and specifically, I'm just sitting here kind of really just amazed at how much you can really focus for some of these disease states that are devastating, to catch them that much earlier. And specifically, it is game changing. So then, as we talk about it revolutionizing healthcare as a whole, companies coming out with all of these new advances in technology, how does that affect those in the medical device industry selling these products? Do you see this opening a whole new era?
I do. Okay. I'll just give you one example. There are plenty of patients that never get diagnosed. I don't care what the disease state is, right? You could talk brain, you could talk aortic, you could talk PAD is a great example. Plenty of diseases don't get diagnosed. What AI is going to do, it's going to find all those patients that have never been diagnosed and flag them. And so if I'm a physician, and let's say I'm an interventionalist, pick whatever one you want, your volume is going to go up significantly, because you're going to find all these patients you would have never have known in short order. And that means if I'm talking about medical devices, well, if I find more procedures, I'm probably going to use more medical devices. And if I was a medical device rep, and I've told this to a few people, I would get really familiar with AI, because you probably can help your physicians find legitimate patients that are new to their system that they would have never found before. Since we're on a medical device podcast, if I was a medical device rep, I would be very educated, walk into every single one of my physicians and say, I can probably find you 20% more procedures. Would you like that?
Yeah.
Instantly.
That's
Yeah,
like a built-in market
Like free
referral right
screening.
there.
I've only had a couple physicians say no to that. I'll be honest with you. It's like, oh, I'm already too busy. I can't have it anymore. I'm being honest. That's what they've said. But on average, it's 20% more procedures when you institute AI. Pick any procedure, whatever it is, I will find it. And I'll say, for this AI software, the return on investment is so big. You're talking 5 to 10x. So in this world, you can't just be clinical, right? We have all these clinical benefits, but you also have to have financial benefits for the administrator because they're looking to say, where am I going to place my bets? I have this set of money. Health systems run a 1 or 2% margin. They have to make an investment somewhere. And if you have an investment that's 5 to 10x here, that impacts patient care in a positive way, delivers a 5 to 10x ROI, and becomes very effective operationally, those 3 areas you impact, that's highly successful for a health system, highly successful. But for medical device professionals, I would learn within your disease state what AI is out there and what could drive more business. Chances are they already have AI. They just have to add a module. My company has more than 2,500 health systems around the world, and a significant amount are in the US.
Wow.
Okay. I talked to some of your customers, Lisa, and one of them said to me, well, why would I get anything else? You're already in my system. I might as well try your software out and put it in. And he's right. We're already there. All you have to do is add another module for another disease state, and you're picking up more procedures. It's a little more complicated than that to, of course, deploy, but it only takes a few hours. This does not takes days or months or whatnot. Once you get the IT lined up, it's very quick and it's very impactful at the end of the day. But again, given we are on a medical device podcast, every medical, I don't care what the disease state is, I would become an expert. I would get to know some of these AI companies, some of their reps, and how could they actually impact my business as a rep. I mean, to me, that makes complete sense.
That's a great piece of advice, connecting with those reps. I didn't even think about that, Jim, but I mean, that's all networking, especially when you can bring value to your surgeons in a very, what sounds like potentially quick and easy solution that may already be in their hospitals and they don't even know about it. I bet most of my physicians probably don't know to the degree of what type of AI they have in their systems, or potentially what they could have. Like you mentioned, one of my physicians, who I'm not sure who it is, but it's sitting in their hospital records right now, and all they have to do is add a couple more modules for PAD, for aortic, for whatever it is. That's huge. That truly is like market referrals to like the nth degree without all the work.
That's a very interesting take. That's a very interesting take. But I will say we've never had a system not find more procedures when we put in AI. It's a guarantee. Because again, you can't screen for everything at all times, but AI can. And you can't ask the radiology teams to do it. You know, there's a shortage of over 4,000 radiologists in the United States alone.
I did
right?
not know
And,
that.
Wow.
Over
didn't know that.
4,000 in the United States. Now,
Wow.
if you go to all the, what I call the teaching institutions, they don't have those shortages. Outside of the teaching institutions is where you have a problem, right?
Yeah.
And that's where AI really comes in handy. Because when you go to a teaching institution, they have a whole program, they have all the staff, they're looking at everything. It's the rule, it's the spoke that you can't find anything, you can't find everything, you can't catch everything. And then, oh, by the way, sometimes, they don't want to go to the main campus. Wouldn't it be nice to be able to catch everything from all the spokes and feed them into the hub? And this is what some administrators are looking at. There's this other thing called patient leakage. They get scanned, they get diagnosed, and then they don't know where they went. Well, AI can shore up any type of health system. And so you can go to zero patient leakage if you had connected all the spokes with the hub through AI.
Wow.
And this is yet
That's
another
phenomenal.
benefit.
Yeah.
It's highly competitive in healthcare and with these health systems. They don't like each other. They're competing with each other. Like we're competing, you may be competing with a competitor. So that's important. I mean, there's some tech coming out that maybe on the next podcast I'll share with you that will, just blow your mind that nobody else has come out with. And we're not the only company coming out with this kind of stuff. Yes, we're the leaders in our space, but there's other spaces that we're not in that there are leaders out there and they're running as fast and hard with tech because look, it's not a medical device. I don't need a 3-year PMA clinical trial. Now, there are levels of approvals within the FDA, but once you code and submit, you can get something done within 6 to 9 months. Now, you should validate it. Everything should be validated, right? In my company, they tend to really validate everything. They have over 300 articles, 12 in the New England Journal of Medicine. So that's all clinically validated. And that's really important. The three of us have been dealing with the surgeon world for a long time. There's nobody that cares more about validation than surgeons. And I'm proud to say that, a lot of our stuff has been clinically validated. It was one of the reasons why I came to the company I came to. Because anybody can create an algorithm. It's another thing to validate it and make sure it works. And not only make sure it works at one institution, but throughout the system. Because everybody's looking at systems now, right? Rare do you find an independent hospital completely operating on an island. It's more and more consolidation. It's more and more healthcare systems, and it's getting more and more complex. And I will say that artificial intelligence has got the ear of everybody in the health system, the C-suite, the IT department. Look at the cybersecurity that's happening in the United. Look at the cyber attacks to hospitals. Okay. You have to, from an artificial intelligence standpoint, you have to kind of think about that as you're developing your solution. So it can't just be about putting it. What if you can't run the algorithm because you had a cyber attack? So you have to put things in place that protects the institution from those cyber attacks within your own world, within your own disease state. It's a complex scenario. You deal with radiology. These, like I said, these guys are some of the unsung heroes that are literally looking at 300 patients a day and night. It's a very taxing job, and you can't catch everything. So the interventionalists, and it's not just one interventionalist. Think of all the disease states and all the many physicians, cardiac surgeons, neurosurgeons, interventional neuroradiologists, vascular surgeons. You just keep going down a lot. Interventional cardiologists, they're all doing procedures, right? At the end of the day. And this all matters to all of them. And then you think of the healthcare and the medical staff, the nurses, the NPs, the lab techs, et cetera. There's a lot that goes into AI and how it can impact everybody across the board. That's what makes it so exciting, though.
It's unbelievably exciting. I was just listening to you. It brought me back to thinking, whatever in my lifetime has had this much focus, this excitement and advancement, and all I can think about is like when the internet launched. And do you remember
It's a really good example.
People were like, wait a minute, I can what is this Google thing? And now look at us, and to be a part or be able to have faster screening, better healthcare. It's just pretty amazing. And to watch it roll out is just a great opportunity for all of us. So that being said, you mentioned 3 great things when you talked about how financially the ROI for the institution, how it can impact patient care, and also operationally. Everything we hear is so amazing. But I got to ask you the hard question. What is the flip side of this? What is this where some people may be apprehensive? Is there things we should be concerned about? Or is this really all the amazing things that we see coming?
There's always a concern, right? I think the thing about AI, it's not at the beginning stages. I would say the beginning stages of AI were probably 14, 15, maybe all the way to 18 when the guidelines changed. And now everything's hyper accelerating on technology. So to be concerned about, I would be more concerned about being left behind than embracing AI.
Love it.
For sure, because it's not going away. And it's not going away in every facet of our life. And I think that's a great analogy to take the web when that was launching and how AI is the trajectory of AI now. And again, in all facets of life, everything is going to change from an AI perspective. And in healthcare, if you're not embracing it, you will be left behind. If you don't get your hands around it, I would prefer to get ahead of it, be on the forefront. But if by at least embrace it and learn about it and figure out how it can work for anybody in any facet within healthcare. Every single part of that healthcare chain has some type of AI that's accessible today. It may not be perfect. Okay. Yes, you can get a false positive. That's going to happen, especially on a newer module. A lot of the clinical validation coming out now, but the sensitivity and specificity are through the roof, 99, 98 plus. You're not going to get much better than that. You could say 100, nothing's 100%. So brace yourself for a few false positives, but I'd rather have a false positive and miss something, right? I'd rather have something detect than nothing at all detected. And I think if you're looking for perfection, the human eye can only catch so much. I mean, I look at the advancements within breast cancer and lung cancer alone. Those 2 areas, there's a lot of AI going on behind the scenes of detection of those disease states these days. And that's exciting. But I'm excited about what's not even being worked on yet and what the possibilities of those disease states and those outcomes can be. I liken it to, remember, I don't know, I'm a little older than you 2 ladies. I remember the Jetsons, and I remember watching the Jetsons. You remember them?
Of course.
Forget it. And thinking that is never going to happen.
Yeah.
Well, by God, that's going to happen. And it's in our lifetime, and I'm excited for our kids. Again, you don't have to know how to program. You just know how to use a tool. I don't know who invented the calculator. I don't need to know how they make a calculator. I just need to know how to use a calculator, right? It's the same thing with AI. I just need to know how to use it. And oh, by the way, ChatGPT, if you're not using ChatGPT today, you're making a big mistake. ChatGPT can impact your entire medical device life, flat out, okay? I have seen medical device people create entire curriculums within 30 minutes on ChatGPT. Okay. That would take
Wow.
3 days,
Wow.
30 minutes, ChatGPT. Okay. If you guys
Crazy.
haven't figured out how to use ChatGPT yet in your everyday life, start to. And there's many other packages and software like ChatGPT. It's not about how hard you work. It's just about how smart you work. And if you can help somebody else do the work for you so you can do what you do best, which is interface with your customers, that's what you want at the end of the day.
Wise
Man,
words.
Jim, you have left us with so much great information. And I mean, we could sit here for a long time, but we're going to bring you back instead and have you talk more deeply about AI. And we'll have some new questions for you. We'd also love to talk to you about leadership because you're a phenomenal, great leader. Cindy and I both saw that
I
firsthand.
second
And
that.
so many of us have experienced your great leadership qualities. But tonight was enlightening, very educating. I feel like I'm behind the 8 ball right now and that I need to go Google and Chat GPT my way through AI.
I love it.
You said it best. Working smarter, not harder.
Not harder. Yep.
You can be very excited for the future. Very excited.
Well, it's been an absolute honor to be on your podcast. Again, I think you two are some of the greats within this business. And I know you have done great things and you'll continue to do great things. And now you got yet another fan for your podcast. But I've always been a fan of you too, so that's a little biased anyway. But you guys are two of the best, and I can't thank you enough for having me on. And it's been an honor and a privilege.
Thank you
Thank
so
you
much, Jim.
so
Have
much.
a wonderful evening.